Hello, and welcome to ASMR TirarADeguello. Are you hoping to calm your mind, relax your body, or experience ASMR? Dr. Andrew Michaels is here to help you. Today, Dr. Andrew Michaels treats a fairly serious but routine leg wound. So what is it about this particular case that has the doctor feeling a bit flustered?
Good morning. How are you today? My name? Sorry, I should introduce myself when I walk in the room. My name is Dr. Andrew Michaels, and I am here to help you. What is the condition you came to see me about today? It's on your leg? Okay, may I have a look? Okay, let me get in closer. Can you roll your pant leg up just a little bit so I can... There you go. There. And it's only on the one leg? Okay, let me do a cursory examination. Do you mind if I touch it? Thank you very much. And it's only on the one leg. That's strange. Well, let me get some gloves on. No, it's okay. I totally understand. These things happen. And with all my experience, I've seen that where you only get the rash on one leg. You really don't know, you know. It's one of those things. You never know how the body's going to react sometimes. But this rash is so deep in the tissue, I'm very concerned. You know, as I come in closer to look. Oh, that is. Yes. Can we check a few things? Do you mind? Okay, with this tool, I'm going to check your reflexes. I know it might sound a little odd, but this can be telling how much tissue damage is involved. So if you don't mind, just let me take the weight of your leg. Rest it on my hand. Okay, thank you very much. Feel that? How about that? No? Now I'm going to ask you to make your ankle very limp. Let me take the weight. Okay, can you feel this? No? This? No? It's very strange. Now, the other end of this tool is not sharp, but it is a pointed end. Do you feel that? Very interesting. Thank you very much. Now, if I could get you to sit back a little bit. That's right. Just move back into the... Lay down. And I'm going to roll your pant leg up just a little bit more. Okay. And I'd like to roll the other leg up to just check both legs, you know, at the same time. Is that all right? Okay, thank you very much. You're right. I don't see the rash on the other leg at all. Now, if I may, with your other leg, let me take the weight of your knee, okay, And I want to see if you react to this. Very good. Thank you very much. And I'm going to check your ankle. Is that all right? Okay. Let me take the weight. That's what I expected. Okay. And using the other end of my tool, the sharpened end, do you feel this? And this? And this? Do you feel this? And this? Okay. That's very interesting. Okay. So, definitely your right leg has a severe problem. We're going to take some scrapings now. Just kind of get an idea. Just put it in this petri dish right here. Some more scrapings. Put it in this petri dish right here. Yes. Oh, I know the trains are something else in this area. I'm surprised you were able to take a train coming in today. Mm-hmm. You can walk with a limp. I understand. Well, it's nothing to be ashamed of. Just because you have to limp doesn't mean, I think people are understanding. Do you have a cane? Okay. Well, we can provide you one if you think you need one. Okay, very good. Well, I'll see to it. I'll write it in your notes. No, you're welcome. It's not a problem at all. It's the least I can do for you. You are in our care here. And we want you to have the best care available. After all of the things you've done for our wonderful country, it's the least I can do for someone of your stature. Well, I know some people don't like to be called a hero, but I think you've done a lot. Do you think you can remove your pants so I can see further up your leg to find out where the infection and this rash stops? Okay. You'd prefer not to? You're sure it doesn't go past the knee? I really would like to check. Are you sure? Well, I'd really hate to do that. If you're shy, we can provide you with a changing area. I just wanted to... Okay. All right. It's up to you. I'll just use these scissors and I'll cut the fabric. I only need to go a little bit higher anyway. I just hate to ruin your pants. But seeing as you're comfortable with it, we'll do it. Okay. Very good. Okay. Now, let me just slide that up now. I hated to do that, but you are correct. It does stop below the knee. I hope the lab, I'll have to make a quick phone call. I want to get these results checked right away at the lab. I think I know what this is. It's definitely a bacterial infection. There's some deep tissue damage and it's affecting your reflexes. That's why you're having trouble walking. Now what's happening is the infection is getting into your bloodstream. We're going to have to provide you with an antibiotic to help you get rid of that and the spread of it. Yeah. No, I understand. Well, thank you. I don't know if I've even made the proper diagnosis until I get results from the lab. But I want to definitely start you on a course of antibiotics just to make sure. So I'm going to give you a small injection. Okay? This won't hurt a bit. I'll just pull this needle back and dab the area with cotton. And give you the shot. Okay. There you go. You'll feel right as rain by morning. Now we may have to see about getting you some hospital rest for just a day or two. Are you able to stay? Or should I schedule you later? Well, I was thinking if you had to go home and take care of some arrangements before you started your hospital stay, I think in this case you've managed to walk here. We could get you a cab back to your home and then return you safely to start your stay. I'm going to start writing some notes down. Okay, so you can stay right away. Okay. Well, I understand you're not working right now. You're a national treasure, and I know you want to go to work, but sometimes you can't. Sometimes your health has to take a prerequisite to work. We can't have you going around being sick. That wouldn't do you or the rest of us any help. So. Oh, you're feeling better already? Well, a person of your stature probably does have a very strong autoimmune system, and I'm sure that the medicine I injected you with would probably have an effect. And it's always good. I always noticed, especially like when I have a small common cold, if I take a aspirin or maybe some cough syrup, I have like an immediate placebo reaction where I just feel better. Have you ever felt that way? Yeah, me too. It's funny. You have a stiff neck and you put Bengay on and it hasn't even had time to react to your skin and you already feel better. Just from the sensation. I totally understand. Well, we owe you a great debt, and it's always nice to see you, so I have no problem. When have I seen you last? Well, you don't remember me, but I remember you. I saw you on the news the other day, and I couldn't be more proud. It's not just being patriotic, it's about, what's right in the world and seeing how you stood up for so many people in this country and around the world. I found myself, I don't know, I felt like I knew you. I know that might sound odd, but I just felt like I already knew you. Is that strange? Well, it is strange sometimes. You never know what to expect from people, and I must say I didn't expect you to act the way you are right now. I thought somebody of your nature and your position in society, and I don't know, I guess I had a little bit of hero worship involved. I expected you to be more aloof than you are. You're very down to earth. That's a pun. And, well, I know it's hard to find medicine in places to get treated, so the needles I use are particular to your physiology, and the medicines I have are basically tailored for your biology. So I know I only have so many courses of action if we do find a issue with your body. And I must say, is it too much to ask if I have a daughter. I do. I have she's older now. She's 15. 15 going on 32. Yes. I know this is a little bit of a breach of protocol, but I don't know if I'll ever get to meet you again, and I'm a little overcome in a little bit of hero worship. Would it be okay if I asked for your autograph? Well, you are my hero. I'll give you that. I have a really nice pen here. Let me get it, and some paper here. Okay, right on this back of this cardboard. There you go. Well, thank you. Oh my gosh. You know, sometimes, as funny as it sounds, you still feel like you're that 13-year-old boy or girl that is meeting their hero for the first time. And I really didn't expect you to be the hero I always envisioned. I thought you'd be, like I said, different. But I couldn't. You're just, to me, if I didn't know that you had superpowers, and if I didn't know your history, and I didn't know all the things you've done, I would think you were just one of the normal people I meet every day of the week. I hope that's a compliment. Well, thank you. You're welcome too. Me? Yes, I'm the doctor here at the Department of Navy Special Services, and we do take care of ultra-humans, metahumans they call them, on occasion, and mutated humans. I have dealt with some aliens. I am not an actual medical doctor. I have a doctorate in astrobiology with the University of Chicago, the first university to have a degree of this nature. And I have, believe it or not, dealt with many alien physiologies and biologies in my lifetime. Yes, I was the scientist at the original Roswell landing. That was terrible how that was handled. I'm surprised you know about that. Well, the local boys didn't know how to handle the situation, and one was dead, one was very injured, and you needed constant medical care, and he wasn't getting it. He wasn't getting proper medical care. They almost killed him just by trying to keep his airway open. And then one was relatively healthy with some glass debris in his eye and some damage to his body, and he was the one I first met, and he was able to communicate with me. And it was pretty much a major coup for me. President Truman sent me straight away, and luckily I got there in time before any lasting damage was done. And we saved both of them, and you've met them? Oh, they're very nice people. Well, it's interesting, isn't it, how small a universe it is when you start to find out that aliens literally walk among us. It's very strange. No. I'm very, very content with my position in the universe. I mean, after all, you came from a planet that was destroyed many years ago. I can't imagine what that's like to lose your home world. I did help an alien that lost their world similar to you. The whole world was destroyed, but it was in a war situation. And it was a child survivor, but they were older than you, not a baby. Mm-hmm. Yeah, you've met them too? Oh, what a dear soul. What a dear soul. And you know what's funny? Her world was destroyed, and she helped save ours. We couldn't have defeated the, we call him to this day the alien scientist, without her help. We had no idea, absolutely no idea how to stop him. I know. what a situation to be in. Well, after he tried to pull that false Armageddon with us and the rapture and all that stuff with the time-traveling Judas Iscariot, I was completely dumbfounded that other aliens would come to our aid. But they did. They came to our aid because they were victims, and they didn't want us to suffer like their worlds did. The universe is full of good and evil alike. I've really discovered that. No, I do understand. I understand. Well, I'm glad you and your cousin feel at home here, and I know it's not Krypton, but I think it's a nice little place to live, a nice little oasis in the middle of nowhere. I think that's why it was chosen as the destination, because it gave you a chance, both of you and your cousin, a chance to grow, mature, and survive. I know I'm right next to a train station, and it's constant sometimes. But I get home on time every night because I don't have far to walk to the station. Of course, I can't fly like you. That must be amazing. I feel terrible destroying your pants like that. I'm sure I can help you out with that. No? Okay. Well, I'm just glad we had this chance to meet and treat you, and I will let you know on the results, and I really do think you should stay overnight at the hospital, but I don't know if you're aware of this, but while we've been talking, your leg is just about healed. Your Kryptonian physiology is amazingly fast. I've never really seen healing factor like that before. That's amazing. The reaction to the medication is incredible. Do you mind if I inspect it? Okay. Thank you very much. Let me just take a quick look. Just want to feel it. May I check you for reflexes really quickly? Just on your one leg. Let your knee, let my hand take the weight. See? And now with your ankle, I'd like to, let me take the weight, go limp. Okay, hold still. Okay, thank you very much. That's amazing. Look at that. With the sharp pointed edge of my tool. Can you feel that? How about that? And that? And that? I am amazed. Your reflexes have returned. Your skin looks healed. And the deep tissue damage is all but evaporated. That is amazing. And your skin has the texture of steel. It's very cold. I expected your skin to have a warmer feel to it due to your ability to absorb solar energy, but it's actually quite cool to the touch. I'm amazed. Well, it must be the way your body regulates body temperature, I suppose. If you ever want me to study your physiology better, I can do that. Okay. No, I understand. You have a right to your own privacy. No. I totally understand. Well, thank you once again for joining me. I'm very glad I got to meet you. If I may shake your hand. Thank you. Yes, Dr. Andrew Michaels, Department of Navy. No. There won't be a bell. Consider this one on the house. Yeah. Well, thank you. And I hope you have a wonderful day. You too. That's very nice of you. And I always try to tell my patients, until I see you again, please have a most blessed day. Okay? Okay. All right then. Bye-bye. Bye. Wow, that was cool.
Thank you for joining us for ASMR TirarADeguello. Please take a moment to rate and review this podcast. If you are interested in additional ASMR content, you may view our library of videos at youtube.com/TirarADeguello. The theme song, Atlantis, is by Jason Shaw of Audionautics.com and is used by permission. Correspondence, including questions or requests, may be sent to TirarADeguello@gmail.com. On behalf of Dr. Andrew Michaels, thank you.